So congratulations. You have developed a brilliant strategy for your next healthcare marketing campaign, and you are excited to get into that wonderful execution place, to get that campaign out on the air. But you have one more hurdle that you have to jump through, and it's often that hurdle that is the biggest challenge for our healthcare marketing clients, and that's getting buy-in from the C-suite. That immortal presentation in the boardroom where you get your colleagues together to review your recommendations. There's a lot of challenges with this because there's always that devil's advocate. There's always that one person who likes to put you on the hot seat, ask the tough questions. And there's always those beloved colleagues who are brilliant in the work that they do, but when it comes to marketing, aren't so brilliant. And they're often to the detriment of your recommendations. So how do you manage that process? How do you overcome that important hurdle? Well, the approach that we use is a presentation style called A.P.E, or A.P.E model. The A stands for approach, P stands for process, and E stands for evaluate. Now, in the approach phase, you set the table with your presentation. You begin by letting them know what to expect, how to evaluate the work, and the process that you'll go through. And those are the two other steps. Process is important. You've taken a series of steps to get to this place where you have your brilliant strategy. You need to walk your colleagues through that approach, through that process. Let them know the research that you've conducted, what the research yielded, how it informed your recommendations. And the key thing with process, and why you don't want to skip it when you're presenting to your colleagues, is because done correctly and done simply, by the time you get to your recommendations, your colleagues will be completely on board. There's no hard sell involved. You're not selling anything. You're simply sharing the insights, and the recommendations take care of themselves. And the last piece, evaluate. You start your presentation by identifying up front how you want the C-suite, your colleagues, to evaluate your recommendations. Are you asking them to do an up or down vote, to pick between several options, or simply to be aware of what you are planning to do on behalf of the health system from a colleague-to-colleague perspective? Allowing your audience to know how you want them to evaluate the work, what your expectations are, will yield great results, I promise you. I'm Stephen Moegling from Franklin Street. This is Madeira, and we wish you success.